I now welcome representatives of Wellfem, Her Health and Aesthetics, and Meno Doctor, who are joining via video conference from New Zealand. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. For the Hansard record, will you please state your full name and the capacity in which you appear today? And I'll start with the people from Meno Doctor who are on video conference.
Hello, can you hear me?
Yes, we can.
Wonderful. My full name is Linda Deer. I'm a GP and menopause practitioner based in New Zealand, and I'm the director of Meno Doctor, a private menopause clinic here in New Zealand.
Thank you. And I just note for the witnesses that are here, we have media in the room, if people are comfortable with that. Yep. All right, thank you. I'll now go to people at the table.
My name is Dr. Virginia French. I'm a primary care physician and I have a business in women's health called Her Health and Aesthetics. I provide menopause care and other women's health subspecialty care.
Dr. Kelly Teagle, I'm the founder and director of Wellfem Telehealth Menopause Clinic. I'm a GP.
I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. Oh, I've done all that. Sorry, it's been an early start. I now invite you to make a short 3-minute opening statement, and at the conclusion of any remarks, I'll invite members of the committee to ask questions. And again, we'll start online.
Okay. Menopause is a biological certainty. And although for each woman, menopause will have different symptoms, ranging from none at all to debilitating, come at different ages, and have different causes, not every menopause is natural, despite this variety of experience, it is a truly unifying event that all women share. But sadly, it often ends up being a really lonely and confusing time. That is what I've heard from patients in my clinical practice over the years. It's what I heard from the over 5,000 Australian women who completed my survey, and it's how I felt myself when I started to get perimenopausal symptoms. Too many women either don't even know it's happening, or they do know, but they don't feel able to talk about it, so they suffer on alone and in silence. So we have at least 2 big problems to sort. 1, the stigma and silencing of menopause, and 2, the lack of good information reaching people, women and doctors. In terms of the first problem, there are messages out there, some coming from large healthcare organisations, saying to women, menopause is easy for most of you, so don't talk too much about it and don't be too negative about it, or you will look weaker than men in the workplace, you will frighten your fellow younger women, and you will help scrupulous businesses cash in on menopause. And I'm talking here about the ones who are ripping women off with remedies that don't work and hormone tests that are pointless. So in the face of all this, what do women do? We put the brave face back on, we keep stum, and we stay lonely. The second problem is information. It used to be a total lack of information out there for women and doctors. And this is still the case in a lot of places, especially in healthcare. And often women themselves are not aware that perimenopause can start around the same time our fertility declines, which is from age 35, or that hormone changes can cause all kinds of symptoms. You don't have to have hot flushes or a dry vagina. But on the flip side to that, we've also got this avalanche of information, and some of it's good and some of it's bad. And it can be really hard to tell the difference. There's also a lot of mixed messages and bickering going on, and women are stuck in the middle just trying to figure out what's best for them. You've got people saying we're over-medicalising menopause and HRT and testosterone prescribing is out of control. You've got other people saying we are under-medicalising menopause and women are getting fobbed off by their doctors, denied HRT, and being told it's all just the stress of midlife. So the information is too confusing, the experience is too lonely, and until we do something about both these things, women will continue to feel fobbed off, ripped off, and quite rightly, pissed off.
Thank you.